High blood pressure or hypertension is a common and often silent condition that may exist without obvious symptoms while still increasing the risk of heart disease and stroke. Blood pressure can often be improved through steady daily habits combined with appropriate medical care. Before trying to lower blood pressure, people should first make sure they are measuring it correctly. It recommends using a validated upper arm cuff, avoiding food, drink, smoking, caffeine, or exercise for 30 minutes before measurement, sitting quietly for at least 5 minutes, and taking at least 2 readings, 1 or 2 minutes apart. Home monitoring is especially useful when it is combined with support from a healthcare team. The main blood pressure categories are from normal values below 120/80 mmHg to elevated pressure, stage 1 hypertension, stage 2 hypertension, and severe readings above 180 and/or 120. A reading above 180/120 should be repeated after 1 minute, and if it remains high with symptoms such as chest pain, shortness of breath, weakness, vision changes, back pain, or difficulty speaking, emergency services should be called. A diet is recommended, especially a DASH-style eating pattern based on vegetables, fruits, whole grains, beans, nuts, fish, poultry, and low-fat dairy. Also, reducing saturated fat, sugary drinks, sweets, and especially sodium. Adults should generally stay below recommended sodium limits. Much sodium comes from packaged and restaurant foods rather than only from the salt shaker. Potassium-rich foods are also helpful because potassium can counter some sodium-related blood pressure effects, though people with kidney disease or certain medications should ask for individualized advice. Physical activity is another essential strategy, with a target of at least 150 minutes of moderate aerobic activity per week, or 75 minutes of vigorous activity, plus strength training on at least 2 days. Less sitting and small bursts of movement can also help, especially when activity is increased gradually. For people who are overweight, even modest weight loss is beneficial, with losses of 3% to 5% improving blood pressure and larger losses supporting broader cardiometabolic health. Alcohol and tobacco are important risk factors since excess alcohol can raise blood pressure and smoking increases the risk of heart attack and stroke. Sleep is closely linked to blood pressure, adults being encouraged to aim for 7 to 9 hours of quality sleep and to consider evaluation for sleep apnea when symptoms such as loud snoring or daytime sleepiness appear. Stress may not have a fully settled long-term relationship with hypertension, but it can trigger unhealthy behaviors and temporarily raise blood pressure. Suggested responses can include regular exercise, breathing practice, meditation, better sleep, and mental health support when needed. Lifestyle changes are foundational, but many people still need medication and should take it exactly as prescribed rather than stopping because they feel well. A simple 2-week starter plan based on accurate home measurement, 1 realistic goal, DASH-style meals, sodium reduction, weekly physical activity, better sleep, medication adherence when prescribed, and contact with a clinician when readings remain high or special concerns arise.